3 years after the coronavirus arrived in the country, Japan is considering revising its recommendation that people wear masks indoors, a government source said Saturday. The policy change, which would recommend that only people with symptoms wear masks indoors, has been floated as government discusses downgrading COVID-19's classification to the same level as seasonal influenza. In its anti-coronavirus measures that were revised last May, the government said that the masks don't need to be worn outdoors as long as people are not talking, although many people continue to wear the mask despite the change. The guidelines said people were still advised to wear masks when indoors, except in cases where social distancing of 2 meters or more is secured and where there is virtually no conversation. According to the source, the government is considering relaxing guidelines on indoor face coverings as it believes that when COVID-19 is downgraded to a Class 5 disease under infectious disease legislation from the current Class 2, anti-infection measures should also be on par with those taken for Class 5 pathogens. Class 2 diseases are subject to extensive measures, and the classification gives authorities the power to limit the movement of infected individuals and their close contacts. The source said that the policy change on mask-wearing rules may come as early as this spring in tandem with the downgrading of the classification. Calls have been mounting from some lawmakers, including those within the ruling Liberal Democratic Party, to review the government policy on masks. But infectious disease experts and doctors remain cautious about a radical relaxing of mask-wearing rules, saying it is better to put them on in crowded places or when a person is suspected of having the coronavirus. Some also say that ending mask recommendations in Japan quickly, as the United States and European countries have done, could lead to an increase in COVID-19 deaths given the country's large elderly population. According to the Health Ministry, the fatality rate among COVID-19 patients aged 80 or over fell to 1.69 in July and August 2022, when Japan was hit by the 7th wave from 7.92% in July to October 2021, when the Delta variant raged across the country. Takagi Wakita, head of a Health Ministry task force on COVID-19, said that, quote-unquote, with Omicron becoming the dominant strain, experts share the view that the infectiousness of the coronavirus has reached its peak. However, he warned that future variants could invade immunity, although they will unlikely be more infectious than existing strains. Wakita added that, quote-unquote, we can't rule out the possibility that new variants that are completely different from the existing strains in terms of transmissibility and pathogenicity will appear. I am Lovely Montoya of Manila STV.